Good afternoon, everybody. I'm presenting the sustainability guidelines for member states. This is a sort of add-on for this deliverable. And the aim of this add-on was to explain in a concrete terms and plain language what the member states will actually need to do. Because even if miraculously in 2 years all EHR system would conform with EHDS, this would not make EHDS work. The greatest burden of implementations will need to be carried by member states' authorities. It is the member states who are obliged to ensure that the rights of their citizens are exercised and feasible to implement. It is the member states who will need to invest enormously in a comprehensive digital health infrastructure. And while we rely on European funding for a part of this investment, the sustainability, the further sustainability and maintenance will need to be taken care of by member states. Member states may also need to proceed with some legal amendments of their national regulations. And as we all know that such legal procedures may take some time, they need to be started as soon as possible, possibly ongoing at this moment of time. Also, the member states will need to build and provide access services for both patients and health professionals. And to do this, they will need to connect to connect to external systems and data sources from other sectors. And as it happens, proxy service is a good example to illustrate what kind of tasks will member states need to take. As proxy services are predominantly aimed for the people with lesser digital skills, reception of physical or paper authorization will need to be organized. And this is not really a digital technical problem. This is more an organizational endeavor. And to do this, they will need to organize physical sites, offices to receive these authorizations, and of course, provide digital tools to record and store power of attorney documents. And on this photo, you can see a provisionary office from Slovenia. We are currently in the promotional campaign for patient access services. And within this campaign, offices will organized at community health centers and have proven to be very efficient because it is very good way to approach patients from the healthcare. So in a few months, we have already recorded about 8,000 proxy authorizations. It is quite a lot for a population like Slovenia. So I'm glad to sharing this good practice with you. And proxy services are also a good example of cross-sectorial outreach. Because in Slovenia, for example, it takes 4 ministries to provide reliable data or on legal representative. The procedure to appoint legal guard starts in the social service sector, then is executed by Ministry of Justice in the legal sector, then recorded by Ministry of Internal Affairs, who is managing Central Population Registry, and only then this data can be provided over to Ministry of Health, who is maintaining the patient access services. With this, I'm ending our presentation of work package 4. Thank you.
Thank you.